I welcome respective doctors and dear well-wishers to the 926th day of Zoom webinar on IFPH International Session. Our guest for today is Dr. Chiranth. He has did his postgraduate diploma from International Academy of Classical Homeopathy, Greece, and postgraduation MD from Rajiv Gandhi University of Health Sciences. He is the director of Susudi Homeo Clinic, Nelamangala, and practicing since 2010. He is also the secretary of KQHDA. He has been elected as the member of Karnataka Board of Homeopathic System of Medicine in 2012 and known to be the youngest member for the board. He also served as secretary for Karnataka Qualified Homeopathic Doctors Association since 2012 and serving as vice president for Karnataka Qualified Homeopathic Doctors Association since 2016. He was the former assistant professor in Department of Physiology and Biochemistry, RRHMC, Nelamangala. Today, he is here to talk on case-oriented approach. With all due respect, I welcome Dr. Chiranth on behalf of IFPH and all of us presented here. Welcome you, sir.
Thank you, Dr. Elizabeth. Very good evening to one and all, from all of you who are from different parts of India and different parts of the globe. So today we are discussing on a very special topic like case-oriented approach. We are all from different schools of homeopathy. What does that mean? After our BHMS and our MD from various colleges, we have been exposed to various schools. In colleges and during post-graduation, we have followed various methods of handling cases. We have learned Kentian approach, Boger method, BTPB, Boger-Bonning-Awesome, all these things we know. And once we get into practice, we start applying various schools of philosophies in our practice, and we start getting results. We fail in certain things. Then we approach our teachers, we approach our friends, we learn from their experiences. And this is how a homeopath is growing. Generally, he will be a learner for lifetime. So similarly, we are exposed to various schools like I'll come to that. Before I start this presentation, let me salute to all my gurus and well-wishers because of whom I am here today. Yes, we'll get back to the various schools of homeopathy. So there are different schools, and we are all learning from different schools and following and getting results. And generally, we will be stuck to one particular school also in our practice. So as we all know, the types of schools and different types of approach, there are some schools which are mainly focusing their prescription on mind symptoms. So whatever is the case, some tend to extract more of the mind symptoms and analyze according to that, and their prescription is based on that. And we have one more school of philosophy, the Other Song Academy, where we have learned a lot of sensation kind of things, that different dimension of the remedies where sensation is focused main. And we also see some of the practitioners saying we are constitutional prescribers. So what does that mean? We all know about it. And there are a few practitioners who are basing their prescription mainly on the miasms. We know the ICR method. We have heard of Segal method. Some practitioners purely tend to practice on the Bash flask remedies. Some practice on the tissue remedies. Some only on the mother tinctures. So based on these types of schools, there are various kinds of prescribers also. People like to be called themselves as single dose prescribers. And there are practitioners who give multiple doses. There are practitioners who give different remedies, some together, some one after another. So some are using the patent combinations. So this is how homeopathy presently the situation is. And what is the best kind of approach? Generally, a budding doctor or anybody who has passed out from his BHMS will be thinking, after he gets to know about all these kinds of methods and different types of prescribers they are exposed to. And that's a $1 billion question. So where should our focus be? That is what we are going to discuss today. And generally, main point of focus will be the keynotes for a prescriber. And some take the totality of the symptoms. Some make a constitution out of the totality and then prescribe. Some are prescribing based on the pathological basis. So there are also the different areas on which we prescribe. So ultimately, what is the simillimum? What is the outcome? That is nothing but the remedy chosen for the right type of prescription at the end of case taking. See, whatever conclusion you arrive at after a case taking, that is the simillimum, what we are all trying to focus on. And that is based on what the case is actually demanding. And that is called as the patient or the case-oriented approach. So by the end of case taking, the ultimate data what we collect out of the patient with what he says, with what his relatives or bystanders or whatever attender who is accompanying those people are saying, and what the physician's keen observation is. So all these come in totality and we come out with some simillimum. So such kind of various different kinds of cases, just let us have a glance of out of my experience. This is a lady, she was 34-year-old housewife. She was married from my place. She came to me, she showed her hands and there were some eruptions. She said, the doctor, is this allergic rashes curable from you? That's the first question she asked me. And this is what she showed me. I hope the eruptions are clear. And you can see these eruptions on her hands and they are cracked. She had severe itching. It was spreading day by day. And I just asked her, where else it is? She said, the whole body I have this. I said, okay, show me that. And I'll show you the eruptions later. So first she came and she said, all over the body since 1 year, she had this. She used some allopathic ointments, injections, and tablets, and eruptions have increased all over the body. And if you come to the symptoms of that eruption, the itching was more in the midnight, 11 p.m. onwards, and that was ameliorated by cold water, aggravated with warm water. There was a lot of burning. Eruptions were dry and scaly. It was cracked also. And except for the traveling sickness, what she had, and which was better with some homeopathic medication, she didn't have any major past history and nothing specific in her family history. So I just digged into her mind, and she says she was married 14 years back and she didn't have any issue. There were no kids till now due to the less sperm count of her husband. And she has tried all means to make him okay and given some treatment, but nothing helped the couple. So after this situation, there were a lot of frictions from the family, outside the family. And during the course of 14 years, even the husband started losing interest on wife. And they were not in physical contact in terms of sexual contact. And after prolonged conversation with the husband, a lot of frictions, confrontations, she developed a lot of hatredness towards the husband. And this is how the story goes. And as he's not supportive to her, he is supporting his parents, not interested in her and her personal problems. So she had fought with the husband and come out of the house, and she was with her parents when she came to me. And the main thing out of observation, what I found out was she was highly anxious about health. That was 3+ grading which I've given. Like what has happened to her, all these eruptions are seen, and what will be her fate again now, all these things. And when she had all these confrontations with husband, she had severe hatredness. If some of you are having repertories in your mobile or laptop, you can just take out the symptoms and start repertorizing simultaneously, and let me know what are the outcome from your side. And when I asked about okay, now you have come out of the husband's house, so can you forgive him for what he has done, and can you go back to him? She said, no, I can never forgive him. And that was the level of hatredness. She never wanted to go back. And she also could never forgive anybody if somebody deceives her or insults her. That was the level of hatredness, that reaction, what she showed to the people. And she never spoke back to the people who has hurt her or deceived her. And this you can just take into consideration. Out of personal history, and what I came out was she had some desire for sweets, salt, ghee, jackfruit, and she had aversion plain milk. Sleep was disturbed due to itching, and sleep was unrefreshing. She was highly chilly. If you have listened to the symptoms of itching, severe itching in the midnight, better by cold application, I hope you have come out with a remedy. But now again, you see the thermals, she is highly chilly, perspiration profuse and offensive. So there was nothing specific about her menstrual history, and these were the eruptions. You see, in the middle finger of the left hand, it was scratched so much, and you could see some bleeding in that hand. You can see the arms with eruption. These are the thighs, right side. The whole body had such kind of eruptions. So can we just see what remedies we can come out with? Is anyone typing something? No? So when you look into the repertory chart, these were the things considered, like the mind, anxiety about the health, hatredness, sweet desire, salt desire, fat desire, sleep unrefreshing, skin eruptions, itching, and eruptions scaly. And you could see nitric acid standing out, and natramure is next, phosphorus, sulfur, calcarea, hepar, natrium, carb, ars. So I prescribed nitric acid 200 one dose to her. And every week I asked her to come back, because this was my first psoriasis case when I started my practice in 2010. And I was very anxious of how this is going to improve. And every week I've taken pictures from her. You can see the difference in the second week in the hands. And there was some scratching with bleeding in the fingers, and that is all dried up. All the eruptions are becoming thinner. Even the arms, the eruptions have gone, and you could see just the pigmentation. And the thighs, I hope you remember the previous pic. And in the 5th week, if you just see the hands, there are no traces, no mark at all. You see the pictures, and there is no pigmentation also. Thigh, all the pigmentations are dimming, and you see the natural skin. And generally what happens in psoriasis cases, the eruptions will be gone with any kind of medication, any simillimum you give. But when there are seasonal changes, we see the relapse of the eruptions in bigger way. And in this lady, that didn't happen. But she came out with one acute, and she said heaviness of head, change in voice, and there was some change in water. She was thirsty with dry lips. Little water frequently was taken. She felt chilly in the night. There was dryness of throat, and RSAL 201 dose was interfered here. Generally, people think when you give a deep acting constitutional remedy, you should not interfere. But when the picture was so clear, which was indicated towards RSAL, I interfered with RSAL. And she got divorced, actually. Her eruptions were completely gone with homeopathy, and you can see the mehendi in her hand. She got married for the second time. So homeopathy not just cures the disease, but gives life for the patients, a new life. After some months, these eruptions came out in the same lady. You can see small miliary rashes, reddish and severe itching. And I was so curious. Psoriasis didn't return with change of weather or something. But did she had any of such kind of eruptions in childhood? I just asked her. She said yes. In the childhood, she had these eruptions, and these were applied some ointment, and those had gone. And you can see just 1 dose of nitric acid. Later, Arsar was given, and again I repeated 1 dose of nitric acid to her, and even those eruptions were gone. Until date, she had a kid after she got married for the second time, and she's fine, healthy, no other complaints. So you could see the kind of approach in this case. We had a reaction in her to the situations for the different people, the level of hatredness, the level of anxiety of health, what she had. And if you go through the mind keynotes of nitric acid, you find these things. And even the repertorization after the totality of the symptoms. I didn't put skin crack because nitric acid will come out. I didn't want, I generally specific symptoms I prevent in repertory. So nitric acid stood out, and it just cured her, gave her new life. Let us move on to the second case. This is of a girl. She was 11-year-old and 6th standard. Her parents stayed some 40 kilometers away from my place, and they had left her their daughter in a place called Badgi, which is around 300 or 400 kilometers from this place, in some relative's house to study. There was some function in school. This girl, she had some ice cream or something, and she started with cough. And once she started with cough, it was so much that they took her to some local doctor, and cough syrup was given. Later, she started with fever. The medicine for fever was given, the syrup was given. And she started vomiting. She was given one more vomiting syrup. She was taking all these 3 different kind of syrup, but the cough didn't stop for past 4 days, 4 to 5 days. Then their guardians, they were anxious, and they brought her back to her parents, who stayed 40 kilometers away from me. And they left her. They took to one more local doctor, and she was given Visalon. In spite of taking so many syrups, she was not better. So steroid was given. And yet that was not healed by that time. So let us just go through this video and see the intensity of the cough, what she had when she came to me.
ಜ್ವರ ತುಂಬಾ ಜ್ವರ ಬರುತ್ತೆ. ಅದೇ ಒಂದೇ ಉಪ್ಪಿತ್ತಲ್ಲ, ಉದ್ದಾಗ ಸೋರೋದು, ಜ್ವರ ಬರೋದು, ಕೆಮ್ಮು ಯಾವಾಗ್ಲೂ ಬಂದಿಲ್ಲ, ಇವಾಗ ಬಂದಿದೆ.
ನೋಡಿ, ಭಯ ಜಾಸ್ತಿ ಅಂತ ಅಂತಿದ್ರಲ್ಲ,
ಸ್ವಲ್ಪ ಕತ್ಲಲ್ಲಿ ಇರಕ್, ಅವಳಿಗೆ ಒಬ್ಳಿಗೆ ಇರಕ್ ಭಯ.
ಕೋಪ ಬಂದ್ರೆ ಏನ್ ಮಾಡ್ತಾಳೆ?
ಏನ ಹಂಗೇನು ಕೈಯಲ್ಲ, ನಮ್ಮ ರೋಪ ಕಸು
ಜನರಲ್ ನೀರು ಜಾಸ್ತಿ ಕುಡಿತಾಳ,
ನೀರ್ ಕುಡಿತಾಳೆ,
ಜಾಸ್ತಿ ತಗೋತಾಳ.
ಆದ್ರೆ ಅವ್ಳ ಹೊಟ್ಟೆ ಊಟ.
I hope everybody saw that. So there was no gap at all for the way she was coughing. And yeah, See, the cough started 3 days ago, and she was brought on the 4th day to her parents, and then she came to me one day afterwards, and that was out of eating ice cream. There was constant cough day and night, and mother and father, what they used to do, 2 hours, mother used to look after in the night, father was sleeping. Later, after 2 hours, the mother used to go to sleep and father used to come and look after her, because it was so continuous day and night cough. Not better with any of these syrups, including antacid was given because of acidity created with all those 3-4 kinds of syrup what she was taking. And she had vomiting after eating, headache on mental exertion since 2 years. That was the history given by mother, and she had weakness on exertions since 2 years. So there was an acute history and a chronic history also, and the mind was dug, and mother gave out some mind symptoms also. And in the history, she had some bleeding stools 1 year back, and it was treated. And father had migraine, mother had sinus headaches. And if you look at her mind symptoms, she was mingling, in general, timid, irritable at home. And she had a fear of ghosts, being alone, and dark. These were the prominent mind symptoms. And if you look at her personal history, she desired sweets, oranges, boiled egg, and she was chilly. Stools were passed once in 2 to 3 days, and she used to perspire in the palms, head, and neck. So, Calcarea carb 1M out of all these symptoms was given at 5 o'clock after acute history and this chronic symptoms what we took. And I have a video here which I've taken just 1 hour after the cough was there for the past 3-4 days. And just in 1 hour, you could see the changes.
ಸೊ ಒಂದು ತಿಂಗಳಿಗೆ ಆಗೋ ಅಷ್ಟು ನಾನು ಔಷಧಿ ಕೊಟ್ಟಿರ್ತೀನಿ.
ಓಕೆ, ಸಿ ಮತ್ತೆ ಏನು ಬರ್ತೀರಿ ಸರ್ ಅದು?
ಅದು ಪ್ಯಾಕೆಟ್ ನಾನು ಫೋನ್ ಮಾಡಿದಾಗ ಹೇಳಿ.
ಹಾಂ,
ಎಲ್ಲ ಒಂದೇನೆ ನಾಲ್ಕು ಇಟ್ಕೊಂಡಿಲ್ಲ ಅಷ್ಟೇ.
ಜಾಸ್ತಿ ಇದ್ದಾಗ ಹಾಕ್ಬೇಕು ಸರ್ ಅದು.
Now it's
ಫೋನ್ ಮಾಡಿ.
clear, sir. Now we
ತುಂಬ
can
ಸಿವಿಯರ್ ಆದ್ರೆ ನಾನು ಫೋನ್ ಮಾಡಿ.
ಹಾಂ,
ಬಂದ ಕೆಮ್ತಾ ಇದ್ನಲ್ಲ ಆ ಥರ ಕೆಮ್ತಾ
ಕಂಟಿನ್ಯೂಸ್ ಕೆಮ್ಮು ಬಂದು.
She was continuously coughing. There was no gap at all. Now she is very calm, silently sitting in between. Actually, I took a video after half an hour or so, and she was talking after half an hour regarding her marks and studies and other things. And now you just see how calmly she is sitting.
ಸಿವಿಯರ್ ವಿತೌಟ್ ಗ್ಯಾಪ್ ಕೆಮ್ತಾ
ಹಾಂ,
ಇವಾಗ ನೋಡಿ ಒಂದು ಸಿಂಗಲ್ ಕೆಮ್ಬಿಟ್ಟು ಸುಮ್ಮನೆ.
ಹೌದು.
ಸೊ ಆ ಥರ ಏನಾದ್ರು ತುಂಬ ಸಿವಿಯರ್ ಸ್ಟಾರ್ಟ್ ಆದರೆ ಅದೊಂದು ಪ್ಯಾಕೆಟ್
She had a cough, that's all.
ಅಷ್ಟು ಮಾಡಿ. ನಿಮಗೆ ಶುರು ಆಯ್ತಾ ಈಗ?
And now her mother has started coughing.
ಇವಾಗ ಸೈಲೆಂಟ್ ಆದ.
ಅದೇ ಸ್ವಲ್ಪ ಕೋಲ್ಡ್ ಇದು ಕುಡಿದಿದ್ರೆ ಕೆಮ್ಮು.
I hope you could make out the difference from that to this. So, just Calcarea carb 1M 1 dose, where we had the mind symptoms, we had a previous past history and the presentation. In spite of acute, there were certain, we had some strong physical generals, so we could give her constitutional medicine itself, and that has given such a big relief in just 1 hour. So let us move with the next case. This is a case of warts, and you are seeing some eruptions here on the hand here. 2, and this is 3, and one on the left little finger. So warts on the dorsum of the hand, and on the face since 4 years she had these flat warts. And one on left eyebrow, right cheek, wrist joint, dorsal aspect of wrist joint, right middle finger, left little finger, and forearms. And that was just her. That was just the presenting complaints what she had. And in the past history, she had recurrent mouth ulcers. And if you go to the familial history, the paternal grandmother had asthma, and mother she died out of suicide, and she was taken care by some of her relatives. And if you go back into her mind, she was irritable, expressing, feels little difficult to study science and social studies. Others, okay, she scored up to 70 to 80% in her exams. She is a stepdaughter, and mother died due to suicide long back. And so she doesn't remember much about her mother. She was mild, weeping easily. She had fear of dark, dogs, and cats. And looking into her personal history, she had desire for chocolates, potatoes, onion aversion. And since 1 week, she had increased appetite. Thirst was also more, and she was sleeping towards her left side extremities cold. Aversion, milk, butter aversion, and fruits, pomegranate she liked. She loved boiled eggs, chicken, and she was chilly. Motion once in 2 days she passed, and nails were brittle. And she was given Calcarea carb 200 one dose. See, past few cases, if you remember, nitric acid one dose was given after acute arsal was given, and nitric acid was repeated after some time. And cough, that Calcarea carb 1M was given, and SOS 1M was given, and they have taken just once or twice in between. So let us see this scale. What happens? Calcarea carb 200 one dose was given with 1 month PL. And itching was seen in the wards. Few were dull, others remaining the same in appearance. I repeated after 2 months 1 more dose of Calcarea carb, single dose. And during the beginning of my practice, I was little stubborn just to give 1 dose during the consultation, and I was not repeating the doses. So then wards were still seen, and I gave Calcarea carb OD 3 days. 1 dose every day for 3 days, and followed by PL. Patient never returned. And when patient doesn't come back, there are 2 different things. Either the patient is cured, or they have lost hopes in you because they were not cured. And if they're cured, then that's a happy news. But generally, the mind starts thinking of the second thing, that they might have not been cured because of this, they have not returned. That is the thing what comes into the physician's mind when the patient doesn't return. And her relatives also were those guardians who were taking care of her were my patients, and they came. And I asked them why she didn't come back. And they said, it is all gone now. So that's the reason she didn't come back. So I said, please send her back, because I will not have any documentation. And if I say in any presentation that I gave this medicine and she was cured, people will not believe. So I asked them to send her back. And I hope you remember the previous pic where she had 1 here, 1 here, and 3, 1 here, total 3 in this hand. You can see the comparison here. And this the little finger, the what she had. So the Calcarea carb, what I gave her 1 dose might not have helped her. And there was a relapse. Relapse can be of many other reasons. The medicine could have been antidoted because of sensitivity to caffeine, camphor, like Amrutanjan, Jandubam, whatever the patients use. Those things can bring the disease back, or any other antidotes. Or any seasonal changes also, or if the vital force is low, again, it will just tend back to go back to its previous state. And the stimulus given now, after 2-3 months, was OD 3 days. And it is all gone now. So then she again never returned because it is not seen. Let us move on to the next case of lichen nitidus. There were some eruption in both the elbows. The kid who was 8-year-old, and that was since 3 years. Slight itching, not so severe itching, and very rarely he used to rub and itching was gone. There was no striking local symptoms of that eruptions. And he had in the past history the recurrent cold, cough, and he was treated allopathically. He had all over the body rashes 1 year back and treated allopathically, and they all were subsided with the medication. That was the only history what we got. And the father had some skin eruptions between thighs, and mother had umbilical hernia and tonsillitis. And nothing much other than the hypertension and diabetes in the maternal paternal grandparents. And when we took the mind symptoms of this kid particularly, he was restless, difficult to control, and he was very obstinate, dictatorial, tantrums. He was hitting parents. He was very loquacious, and he had fear when crossing bridge. And he was grinding teeth in the sleep in the night. So 3-4 remedies come into mind when you look into these mind symptoms. And coming to his personal history, he had desire chapati, snacks, juices, aversion capsicum, brinjal, potato, and appetite was very good. Thirst was normal. Sleep was good. He was lying on abdomen, and he had a desire for boiled egg more and omelette also. And he had desire for milk, sour food also like green mangoes, and he liked grapes. Thermally, he was hot. Stools were regular, urination nothing specific, and he perspired in the face, scalp, and cervical region. So this particular kind of perspiration also will indicate some remedies. Tuberculinum 200 OD 3 days was given for this case, and PL was given for 15 days. And you can see before how the eruptions were. And in just 1 week of treatment, that was the right hand and left hand, which was fully clear. There were some minor eruptions in the air, just 1 week. So that is the amount of relief what a patient gets in just 1 week. Let us go to the next case. This is the case of a diabetic foot, 42 years old person. He was a second division clerk in agriculture department in the same place where I stayed, and he came with this foot. So it started with a shoe bite. He bought a new footwear, and he had a small pustule kind of thing which started initially after that shoe bite. And it increased in size day by day, and completely it was infected, and the local doctor who was doing dressing, he cleared all these tissues, and it was like this when he came to me. And the diabetic foot, unless and until they control their sugar, it is very difficult to heal the wounds as we see in practice. But what happened for this case? So he was a known case of necrotizing fasciitis. The local surgeon had diagnosed this, and he wore a new footwear, and later it started and increased. Since 2006, he was diabetic. That time he had some pressure during work, and for the past few months he was hypertensive also. And he had history of jaundice, typhoid, fever, and mother was hypertensive, asthmatic, and diabetic. A lot of work stress he had. He had anxiety of health, thinking what would happen for my leg. Should I go for an amputation? And he had a particular delusion where someone is calling him, standing near the door. And work pressure was the thing which a lot of people have nowadays. And he was sympathetic, loquacious. He had fear in workplace, thinking what would the seniors would say if he does mistake. He was a little kind of angry person, and sometimes ego was hurt if somebody says something. He had fear for high places. And you see the desires, chicken, mutton, and idli. He had the sweet desire, half-boiled egg, chili, perspiration in the cervical region and back, burning souls in the night. This was the eruption. After I gave him the remedy, you could see the improvement in the boundaries of this. The wound is shrinking. You can see the granulation tissue. You can see the depth in the first peak and the second peak. It is lesser. You see some more regression in the wound. You see? And this is how it was completely healed within 3.5 months, because 2.5 months it had healed almost 90%. In sleep, he had scratched it and he had made the wound bigger, and it took some 1 month extra to completely cover. What was the remedy you can think of? This person also was given calcarea carb, but here the doses were repeated frequently, 3 times 3 days, followed by 3 days PL, and again it was repeated 3 days. And that's how the wound completely healed. If you recollect the previous cases which I told, so this is the case of renal calculi, and 12 into 6 mm was the calculus. And generally renal calculi means we definitely will think of Barber's Q. And let us move on quickly with this case. He had a picture similar to calcarea, but for him I have given calcarea renalis, which I wanted to cover the kidney stones. And you could see 12 into 6 mm calculus was seen in the impression. And after 1.5 months, you can see right side there were 4 mm calculi and left side 3.8 mm calculi. And that is how the stones were regressed, and definitely it would, if it is 3 mm and below, it would pass out. And one more acute emergency of renal calculi came to me. He said, for the past 2 years, he was a known case of renal calculi. And when he came to me, it was 10 into 5 mm. Generally, above 6 mm, people are advised for lithotripsy. And you see, it was stuck in the membranous urethra. He came out of with a symptom. I was feeling stone inside the urethra. That was the symptom he gave. I just checked, and it was Coccus cacti, only one remedy, and that was given for TID 5 days. But after 4 days itself, he said, the stone is moving, doctor. I'm able to feel it. It has come to the tip of the glands. I just said, tomorrow it will fall. Please take it out, collect it, and send me a picture. Next day, he sends me the pic of 10 into 5 mm calculus. That's how it has come out. This is one more 80-year-old lady who was having gangrene of foot. You see 3 fingers which were completely dark, other 2 are not so dark. And she was admitted in a hospital, given 2 courses of antibiotics, but there was no improvement at all. And they said, up till knee, you have to amputate her. And when I visited her, she opened the dressing and it was completely offensive. The whole room was out of offensiveness. And the symptoms were like she was highly chilly. The pains were more after midnight. Mouth odor offensive, discharges offensive. She had a very strong despair of recovery. Generally, people say, if you have belief in homeopathy, it will get cured. But this lady, when she came to me, I gave her some sweet pills. She said, I took 2 courses of antibiotics, nothing happened. What will these pills do? That was the question she asked me. So when the remedy is right, even if the patient doesn't believe in you, that should cure him. And let us see what has happened. After this, arsenicum album stood out. And you can see the progression in the tissue, the pink tissue, which is progressed here. And date-wise, you can see the improvement. The wound dried. After drying in the 4th week, you see the pigmentation also reappearing. And there are some 3 fingers which are completely black. What is the fate of that? I said, definitely that will come out and it will fall off because it's completely dead. And we can see the last 2 fingers that should remain. And this is what has happened. After week, 1 finger fell on their own. We call it as auto amputation. And the wound completely covered. And the lady, she was cured in 2014. Last year, she expired. Until the death, she was walking on her foot. So that was the relief. That was how homeopathy could help her. And I have the video of her walking. Let us go for the other cases because we have lack of time. This was one more case which was given sulfur.
Sir, we will have another session also, sir, because we are so much interested in your class. Like we want to hear more cases. So for another day, we will take another session, sir, to continue this class.
Yeah, no problem, no
If
problem.
you
no
have
problem.
don't want to end in a hurry, sir.
Yeah. Okay. Okay. Uh, okay, this was a case with similar case taking. We arrived at sulfur. That was the remedy indicated. He went to a surgeon and he got his great toe amputated, right foot great toe amputated. But the wound didn't heal. So then he comes back to me, and within, you can just see around 18 means it is around 15 days, not more than 15 days. It is almost completely healed. So this is how homeopathy can help people. This is one more for which I have given Silesia TID 3 days, and that was also covered. You can see the difference here. And this was a case of my uncle who had a cavernoma which just opened up and there was bleeding. You can see the bleeding in that CT scan, which is appearing dark clot, and in MRI you see the white thing here. See, when you look into the keynotes of Arnica, which is described by Professor Vitolkas, it is available on YouTube. He mentions it has a quality of dissolving a clot. So what does that mean? That is a characteristic of that drug. So that came into mind, and I just gave him Arnica TID 3 days followed by PL again, repeat Arnica, and later this another MRI was taken, which complete resolution of that clot is seen here. So that is what we say as characteristic of the remedy, the sphere of action. That is the importance of the sphere of action. We have to know of each remedy, which comes into mind and we can give. Not always constitutional medicine is thought of. And there was a case of stroke. We will talk about the cases again in the next class. I'll just conclude with the take-home message with this presentation of today.
Yes, doctor. Yes.
The right approach to the similum is not a fixed approach. Like, it is not that I treat only on mind, I treat only on the physical generals, I treat only on the local symptoms. It is not fixed. It is only after the end of the case taking, the patient will give you the set of symptoms and you have to decide based on what the patient says. So every case demands its own variety of prescription. It could be because of pathology, it could be because of mind or totality or any striking keynote. And that will be told by the patient himself. I don't have any right to fix myself to one particular kind of prescription. Let us not follow homeopathy as a cult. This is what my PG guide, Dr. Praveen Kumar sir, who was the guide in Government Homeopathy Medical College, he told me, does not follow homeopathy as a cult. So that is how we have to take from all the schools. We need to come out of the boundaries, explore new things, learn from everybody, and apply whatever we have learned from everybody in our practice. We need to work more on building our knowledge of Materia Medica. Listen to Materia Medica from all the teachers, all the schools, because every sulfur is described in a different way in essence. In predictive school, you get a picture of sulfur. In sensation, you get a picture of sulfur. Take everything, keep in mind. That is how you see it in a patient. If you are stuck to only one particular school, you probably tend to miss. And follow the guidelines of Organon and correlate with the repertory to find the similarities. Read the source book regularly and do not hesitate to try something new to explore. The ultimate beneficiary is the patient himself. Thank you.